They won't tell you this during a regular checkup. But I will, because it matters. If you've stopped masturbating in your later years, your body may already be slipping into decline, and you might not even notice it. This isn't locker room talk or some outdated taboo. This is clinical truth backed by decades of science and thousands of patients. What's at stake? Not just your sexual health, but your brain function, your heart health, your sleep, your immune strength, and even your sense of self. My name is Dr. Thalo Markos, urologist and men's health specialist with over 30 years of experience helping aging adults reclaim control over their bodies. And if there's one thing I've learned through thousands of conversations with patients across the country, it's this: too many older men quietly give up on their sexual health. They stop seeing it as essential. They stop talking about it. And in doing so, they abandon one of the most powerful tools their body still has to stay sharp, balanced, and alive. Here's what most people don't realize. Masturbation is not just a leftover instinct from your 20s. It's a vital, deeply physiological act that supports your body in ways far beyond the bedroom. It helps regulate hormones. It stimulates the brain. It protects the prostate. It boosts emotional well-being. And when you stop, whether out of shame, disinterest, or misinformation, your body starts paying a price you might not see until it's too late. Let's start with one of the most common yet overlooked consequences: your prostate. I remember a man in his early 70s, trim and articulate, who came to see me complaining about frequent nighttime urination. He'd been waking 4 or 5 times a night, disrupting his sleep and draining his energy. "Doc," he said, "I figured I just didn't need that part of life anymore." What he didn't realize, and what most men don't, is that regular ejaculation, even through solo activity, plays a crucial role in maintaining prostate health. Your prostate isn't just a passive gland. It's an active living organ that contracts, releases, and produces seminal fluid. When it's not being stimulated, the fluid inside can stagnate, and stagnation is where problems begin. The buildup of unreleased fluid leads to inflammation, swelling, and a sensation of pressure deep in the pelvis. This doesn't just affect urination. It can impact sexual function, comfort, and even mood. Symptoms start small: a heavier bladder, feeling a slower stream, an urgency that won't quit. But left unchecked, these are the early signs of something more serious. Chronic congestion of the prostate can develop into benign prostatic hyperplasia, or BPH, a condition that affects nearly 50% of men over 60. If BPH progresses, you may face bladder infections, urinary retention, and in some cases the need for catheterization or even surgery. That same patient. He eventually needed surgery to relieve the pressure that could have been managed years earlier with a simpler solution: regular, healthy ejaculation. In fact, one long-term study revealed a powerful connection between frequency of ejaculation and prostate cancer risk. Men who ejaculated 21 times or more each month had a significantly lower risk of developing prostate cancer than men who did not. Let me be clear, this isn't about obsession or fantasy. This is about function. This is about biological maintenance, about honoring the systems in your body that still work and helping them continue to serve you. Your ability to ejaculate is not something to be embarrassed about. It's a sign that your internal systems are still alive, still responsive, still capable. And if you're not supporting that system, you're allowing it to slowly break down. I've seen proud, independent men start planning their days around access to a bathroom. I've seen them lose sleep, lose confidence, and lose their sense of control. And in many cases, this all begins with a silent, well-intentioned decision to stop doing something they assumed no longer mattered. But it does matter, because your prostate, like every part of your body, depends on movement stimulation and release to stay healthy. And ignoring it doesn't make it go away. It just makes it vulnerable. In a moment, I'll show you how this pattern of neglect spreads beyond your prostate to your mind, your memory, your emotions. But for now, let this sink in. If you're struggling with sleep bladder control, or just a creeping sense of something off in your body, ask yourself a question you may not have considered in years. When was the last time I gave my body the release it still knows how to give. You may be surprised how much depends on that answer, and you may discover that getting it back isn't about youth or shame or fantasy. It's about health. It's about taking care of the systems that are still working for you. It's about reclaiming the freedom to feel good in your body, on your terms, in your time. This is Healthy Hues Wellness, and we're just getting started. Let's make one thing absolutely clear. This isn't about chasing youth or indulging in fantasy. It's not about obsession or recreating your 20s. What we're talking about is real biological function, a powerful natural way to protect your body, especially as it ages. When you stop masturbating in later life, you're not simply letting go of pleasure. You're risking something far more serious: pain, inflammation, and the gradual breakdown of one of the most basic human systems, your ability to urinate freely and confidently. I've seen it too many times. Older men afraid to leave their homes because they don't trust their bladders. Proud, once active individuals reduced to sleepless nights and anxious days, mapping out every bathroom stop, avoiding long trips, and waking every 2 hours just to find relief. It chips away at their sense of control. It steals their independence. And all of this daily stress and physical strain, could have been managed, maybe even prevented, by something as simple as regular respectful self-stimulation. This isn't about indulgence. It's about freedom. The freedom to move through the day without fear. The freedom to sleep through the night. The freedom to feel whole and at ease in your own body. Because when your prostate is neglected, your life shrinks. But here's the part many people miss. The issue doesn't stay in the body. It moves inward, quietly, invisibly. It starts affecting the way you think, feel, and remember. Let's talk about mental clarity. A man in his late 60s once sat across from me, frustrated and confused. "Doc," he said, "I don't feel like myself anymore. I walk into rooms and forget why I'm there. I lose my train of thought mid-sentence. I used to be so sharp. Is this just what getting old feels like?" It's a common question, and yes, aging brings changes, but what many don't realize is how directly connected sexual activity is to brain health. Even solo activity. When you engage in self-pleasure, your brain releases a powerful mix of neurochemicals. Dopamine, serotonin, oxytocin. These aren't just feel-good hormones. They're vital for memory focus, emotional stability, and even neural repair. They increase blood flow to the brain. They help maintain the connections between neurons. They reduce cortisol, the stress hormone known to damage brain cells when left unchecked. It's a natural, self-renewing system, one that supports cognition and sharpness in ways no supplement can replicate. But when you stop masturbating, those chemical surges fade. They become less frequent. The brain is no longer receiving the signals that stimulate and protect it. And over time, things start to slip. First, it's minor lapses. You forget a name, you mix up a date, then the doubt creeps in. You start wondering if your mind is fading. You feel foggy, slower, less motivated. And that doubt, it invites fear. I've seen men spiral into anxiety, even depression, all because they misread the signs. They blamed aging when in truth their brain was starved of stimulation, of hormonal support, of the very chemistry that kept them sharp. For men, there's another layer to this. Testosterone. It's not just the libido hormone. It fuels decisiveness, energy, memory, and strength. And when sexual activity falls to near zero, testosterone often follows. Fast. I'm not saying that masturbation alone will keep your hormones perfectly balanced, but frequent healthy release has been shown to support testosterone levels, helping maintain that inner fire, the clarity, the confidence, the drive. Emerging research is even linking reduced sexual activity in older adults to early cognitive decline, and in some cases greater vulnerability to conditions like dementia. Now let's be clear, we are not saying that stopping masturbation causes Alzheimer's, but what we are saying is this: when your brain is denied natural stimulation, regular circulation, and key neurochemicals, it becomes more vulnerable to decline. The rhythm is disrupted, the resilience weakens. This isn't just about memory slips, It's about a subtle transformation in how you show up for your own life. Men stop going to chess clubs because they can't concentrate. Retired professionals wake up feeling blank, like a fog has settled over the day. These are not symptoms that always require medication. Sometimes they are the result of a life disconnected from the body, from pleasure, from presence. This disconnection doesn't announce itself loudly. It doesn't knock on your door. It arrives quietly over weeks and months. And by the time you realize something's off, you're already questioning your own mind. But this doesn't have to be the path forward. Your brain is still listening. Your chemistry is still responsive. And one of the simplest, most natural ways to keep it engaged is to maintain your connection to physical self-intimacy. You don't need expensive programs or supplements to keep your mind alert. You need blood flow. You need dopamine. You need the habits that keep your system humming. Because this isn't about being young. It's about staying whole, staying aware, staying in touch with who you are and how you function. So if you've been wondering why you're feeling foggy, distracted, or unlike yourself lately, take a step back and ask yourself, how connected am I to my own body? When was the last time I gave it the attention it deserves? Because in that simple, quiet act of self-care, you may find the clarity you thought was lost. And you may remember something far more important, that your body, your brain, and your sense of self are all still here, waiting for you to come back. Let's keep going. When your brain is starved of stimulation, emotional release, and hormonal support, it begins to lose its rhythm. It loses the natural resilience that once helped you navigate each day with clarity and purpose. And slowly a kind of fog creeps in. It alters how you think, how you interact with others, and even how you see yourself. I remember one man telling me he stopped going to his chess club, not because he didn't enjoy it anymore, but because he couldn't concentrate on the game. Another, a retired teacher, confessed that he woke up every morning feeling blank, like the color had drained from his thoughts. These weren't medical memory problems. They were symptoms of disconnection from the body, from physical intimacy, even with oneself. And the most tragic part is this: it's avoidable. You don't need expensive medications or elaborate therapies. Sometimes what you really need is to return to something incredibly simple. Reconnecting with your own body. Giving it the care and attention it quietly longs for. Because when the body is stimulated, the brain responds. It wakes up. It finds its spark again. But the story doesn't stop there. The loss of mental sharpness is just the beginning. What often follows is even more subtle and, in many cases, far more damaging: the slow erosion of emotional balance. Depression doesn't always arrive like a storm. Sometimes it shows up as a quiet fog creeping in without warning. I once had a patient, a widower in his early 70s. He was relatively healthy, but something felt off. He sat down in my office, looked me in the eye and said, "I don't feel anything anymore. Not sadness, not joy, just flat." He paused, then asked, "Is that normal for someone my age?" That question still lingers with me because I've heard it over and over again from men and women who are silently struggling with emotional numbness. What they often don't realize is that the emotional dullness they're feeling isn't always about age. Sometimes it's about something far more intimate. The quiet abandonment of sexual stimulation, especially self-pleasure. Masturbation is not just a physical act. It's also an emotional release, a built-in stress relief mechanism your body was designed to use. During climax, your brain releases oxytocin and endorphins, natural mood stabilizers that help regulate emotions, ease anxiety, and lift the weight of tension. But when that release disappears, especially during life stages already marked by stress, grief, or isolation, your emotional world begins to dim. Numbness sets in. Then comes the withdrawal from hobbies, from conversation, from joy. I've watched people slowly drift away from the things that used to matter to them. They begin sleeping too much or too little. Appetite changes. Interests fade. Life begins to feel grey. The worst part: most don't connect these symptoms to the loss of intimacy with their own bodies. They blame themselves. Or worse, they believe this is just what aging feels like. But it's not. What they're really missing is that quiet, essential act of self-connection. not for the sake of fantasy, but for emotional survival. Depression in older adults is frequently underdiagnosed because it doesn't always look like sadness. It can show up as fatigue, irritability, emotional detachment, or the absence of motivation. And while therapy and medication have their place, I've seen lives turn around when patients were simply encouraged to reclaim physical self-intimacy. One man told me that after he started touching himself regularly after years of avoidance, he began to feel alive again. He said it wasn't just about pleasure. It was about remembering that he was still human, that his body still mattered, that his emotions were still valid. That small act, simple as it seemed, gave him back a part of himself he thought he had lost forever. And that's the point. Masturbation later in life isn't about lust. It's not about indulgence or fantasy. It's about maintaining emotional health, about keeping the pathways of feeling release and presence alive. It's about reminding your body and your brain that you are still here, still feeling, still connected. Because when that connection disappears, you don't just lose pleasure. You risk losing your emotional compass, your ability to respond to the world with feeling, with vitality, with presence. Your body is still capable of healing, of sensation of joy. But it needs to be invited back into the conversation. Sometimes all it takes is a small step, a quiet moment, a choice to say, I'm still here, and I still matter. That's not indulgence, that's self-respect, that's emotional resilience. That's what it means to truly live fully, deeply, and without apology. When the emotional bond with your own body begins to fade, what follows isn't just a sense of sadness. It's a gradual withdrawal from life itself. That disconnection doesn't stop at numbness. It can lead to emotional isolation, a quiet shutting down of the senses, and in many cases, a fading desire to even participate in life. But as impactful as that emotional cost is, there's another, more physical consequence that often creeps in silently, and it affects one of your most essential health pillars, your sleep. Sleep is more than just rest. It's the engine of healing, repair, and restoration. And for many older adults, poor sleep becomes a nightly struggle. I remember a patient in his late 60s. He looked pale, tired, and frustrated. He told me, "Doc, I fall asleep just fine, but then I'm wide awake at 2 a.m., like I've been shot out of a cannon. I just lie there staring at the ceiling." We checked everything. No signs of apnea, no concerning lab results. But when I gently asked about his intimate life, he averted his eyes. "That part of me is over," he said quietly. But the truth is that part of him wasn't over. It was simply ignored. And what he didn't realize was that it might have been the key to the very thing his body was begging for: deep, restorative, uninterrupted sleep. Sleep isn't just a matter of closing your eyes. It's a hormonal process, a rhythm deeply tied to your nervous system. And one of the most natural, powerful triggers for deep sleep is one that most people forget about as they age orgasm. During climax, the body releases a blend of chemicals, oxytocin, prolactin, endorphins, all designed to calm the nervous system. These are not just feel-good hormones. They actively shift the body from stress to rest. They slow down the heart rate, reduce cortisol levels, relax muscles, and prepare the brain for sleep. Without this chemical signal, sleep becomes fragmented, shallow, or simply unreachable. Now imagine removing that natural sleep aid from your life. Not once, but for weeks, months, even years. That's what happens when older adults stop masturbating. The body loses a mechanism it once counted on. And what fills the void? Restlessness, tossing and turning, frustration. Some turn to sleeping pills, which only mask the symptoms. Others resign themselves to chronic exhaustion, believing it's just a normal part of aging. But the truth is, it's not. Chronic sleep deprivation carries heavy consequences. It weakens the immune system, dulls cognitive function, raises the risk of heart disease, and leaves you more vulnerable to depression and anxiety. For older adults, poor sleep also increases the risk of falls, worsens memory, and contributes to the slow erosion of independence. I've seen patients once active and engaged slowly retreat from life. Not because of illness, but because they were simply too tired to keep going. And what's most heartbreaking is that many of them didn't even know what was missing. It wasn't a prescription, it wasn't a supplement. It was their own body's built-in release valve, something they had quietly stopped honoring. Masturbation may seem trivial, but for some it's the difference between 4 hours of fitful sleep and 7 hours of deep healing rest. One patient told me after reconnecting with this part of himself, "I sleep like I did 30 years ago. I didn't realize how much I needed that release. I thought I was just getting old." And that right there is the problem. Too many people confuse biological neglect with aging and suffer silently as a result. If you find yourself staring at the ceiling at 3 a.m., your mind racing, your body tense, ask yourself a simple question. When was the last time you let your body truly relax? Not just with a warm bath or breathing app, but with the kind of physical release that your nervous system still remembers. Sometimes the answer isn't more medication, sometimes it's about returning to an old rhythm. A natural one your body has always known. Because sleep loss doesn't just leave you tired. It chips away at your energy, your mood, your memory, and your resilience. And as we'll see in the next part of this journey, the consequences aren't just in your mind. They begin to show up in your physical body, in your posture, your strength, your balance, and even your bladder. But for now, remember, this reclaiming restful sleep might not start in the pharmacy. It might start with reconnecting to the part of yourself you thought you had outgrown, but never truly stopped needing. Let's talk about something most people never think about until it's too late. The quiet decline of the pelvic floor and circulation when intimacy fades from daily life. A few years ago, I worked with a retired firefighter in his 70s, a man who had always been physically strong and confident, the kind of person who never asked for help. He sat across from me and said, "It's strange, Doc. I feel like the foundation of my body is slowly giving out." He wasn't talking about something abstract. He was describing a slow, invisible breakdown of the muscles at the base of his core, the pelvic floor. The pelvic floor is a powerful, often overlooked group of muscles that support the bladder, the bowel, and the sexual organs. They are essential to daily function, yet most people never even think about them until they start to fail. That failure doesn't happen overnight. It begins quietly, often after intimacy disappears. When regular sexual stimulation stops, especially masturbation, these muscles stop being engaged. They stop being exercised. During arousal and orgasm, the pelvic floor contracts rhythmically. This isn't about performance or passion, it's about function. That rhythmic contraction acts as a workout for the muscles, keeping them strong, active, and connected to the nervous system. It keeps blood-flowing tissues elastic and signals clear. But when that stimulation disappears, so does the signal. Blood flow slows, muscles begin to weaken, nerve response fades. Tissues start to deteriorate, and then the symptoms begin. You may feel a frequent urge to urinate. Maybe there's slight dribbling after using the bathroom. For some, it becomes difficult to hold in gas. For others, there's a strange uncomfortable tension in the hips or lower back. These symptoms don't always get talked about. Many people feel embarrassed, confused, or ashamed. But this isn't just about getting older. It's about ignoring a part of the body that was never meant to go silent. In men, this can mean a dramatic drop in sexual function. In women, it can lead to dryness, pain, and discomfort that discourages all intimacy. And beyond the bedroom, it affects everyday life. I've seen patients stop attending social events out of fear they won't make it to the restroom in time. Others have grown anxious over coughing or laughing in public because of sudden leakage. What began as muscle neglect turns into a loss of dignity. Let's be honest. When you don't trust your own body, you start to withdraw from life. You may begin using pads, special garments, or planning outings around bathroom locations. This isn't just inconvenient, it's a slow erosion of independence. And the saddest part is how many people suffer in silence. They think it's normal. They think it's just age. But it's not. Your body still wants to work even at 70, 80 or beyond. And you don't need pills or equipment to help it. One of the most effective and natural ways to restore this part of your body is through safe, regular, intimate stimulation. When you do that, you're not just reviving sensation, you're restoring strength. You're waking up the nerves, you're circulating fresh blood, you're telling your lower body you still matter. This is not about reclaiming lost youth. It's about preserving function. It's about choosing to support your health from the inside out. You are not broken, you are not done, but your body needs your attention. And as critical as this physical layer is, there's another layer just beneath it, one even more vital. Because what happens inside your bloodstream after sexual activity can influence how often you get sick, how quickly you heal, and how resilient your body remains. When intimacy disappears, your immune system quietly begins to lose its edge. And we're going to talk about that next. Because your defenses matter, your health matters, and it all starts with a simple, natural act your body still remembers if you let it. There was a man in his late 60s, once strong and quick to recover from any cold or seasonal bug. He used to bounce back in a day or two, no problem, but now every little virus knocked him down for weeks. We looked at the usual culprits, diet, sleep medications, but nothing stood out. Finally, I asked a question most doctors skip. Have you been sexually active lately, even by yourself? He smiled awkwardly and said, "Nah, that part of me is just retired." What he didn't realize, and what most people don't, is that sexual activity, including masturbation, has a direct biological impact on the immune system. This isn't opinion, it's science. During arousal, and especially orgasm, your body releases a powerful combination of chemicals. Yes, there's dopamine and oxytocin, the ones that make you feel good. But there's also something more critical, immunoglobulin A, or IgA. This is a major antibody that helps your body fight off viruses and infections, especially in your lungs and digestive system. And there's more. Orgasms also release endorphins, which reduce inflammation and support healing. Now imagine being without that immune boost for not just a few days, but for months or even years. Your body loses access to one of its most natural defense mechanisms. And when your immune system is already slowing down with age, taking away that tool is like pulling the batteries out of your smoke alarm. At first it seems fine, but when danger strikes, you're unprotected. I've seen this firsthand. Patients who stop engaging in any form of intimacy often find themselves sick more frequently, healing more slowly, and experiencing more chronic inflammation. They rarely connect the dots, but their bodies are sending a message: something is missing. And it's not just about flu prevention, your immune system is tied to deeper long-term health. Cancer defense, heart protection, wound healing. All of it relies on hormonal balance, stress reduction, and good circulation. All of it is supported by regular, healthy sexual activity. Without it, stress levels rise, sleep quality drops, inflammation spreads, and the body begins to slow down, not because of age, but because of neglect. There was a woman in her 70s, widowed, who came to me with low energy and constant fatigue. She hadn't touched herself in 5 years. When I gently talked to her about the connection between intimacy and immune function, she decided to try reconnecting, not for desire, but for her well-being. A few months later, she came back glowing, more energy, clearer skin, brighter eyes. "I feel like my body is working with me again," she said, "not against me." That's not magic, that's biology in action. When you send your body the right signals, it responds, it fights, it heals, it thrives. And sexual stimulation, even solo, is one of the most powerful signals of life and vitality you can give yourself. The immune system doesn't care about embarrassment. It doesn't care about shame. It only responds to what you do. And while lowered immunity can expose your body to illness, the next and final consequence cuts even deeper. Because when you stop engaging with your body, something more personal begins to fade. You begin to lose your sense of self. I once sat across from a retired school principal in his late 70s, a man who used to stand tall and command attention. But on that day he slouched. His eyes were dull. He sighed and said, "I don't feel like I live in this body anymore. I feel like I'm just inhabiting it. That feeling of disconnection isn't rare. It's something I've heard in different words from men and women alike. It often begins with the quiet decision to stop engaging with your body, to stop touching, to stop exploring, to stop caring. Not because of shame, but because of the belief that those days are behind you, that it's no longer necessary, that it doesn't matter. But here's the truth. When you stop paying attention to your body, you begin to detach from it emotionally. You stop feeling like yourself. You stop noticing how you move, how you stand, how you breathe. You avoid mirrors. You accept pain. You tolerate stiffness. You begin to believe this chapter of life no longer needs nurturing. That is the most dangerous loss of all, the loss of ownership, of worth. I've seen this disconnection lead to shame about aging, isolation from affection, and even neglect of basic self-care. People stop dressing with care, stop eating with purpose, stop exercising, they fade. And not because they are dying, but because they stop feeling alive. But that's not the end of the story. You can come back from that. Reclaiming your body through self-touch isn't about chasing youthful desires. It's about honoring the life still inside you. It's about saying, I'm still here. I still feel, I still matter. And when you reconnect even gently, even in private, you send a powerful message to every part of your being. You remind yourself that you are worth the care, that aging isn't erasure, that your story, your presence, and your body are still here and still deserve to be loved even by your own hands. That is the beginning of real healing. Not from the outside in, but from the inside out. I've heard it again and again from men and women alike in different voices, different phrasing, but always echoing the same truth. Somewhere along the way, they stopped feeling at home in their own skin. And most of the time, that disconnect begins not with some dramatic event, but with silence, with the quiet decision to stop touching themselves, to brush off self-intimacy as unnecessary, to label it as something from the past, something they've outgrown. But what really happens when we stop touching our bodies isn't just a drop in pleasure, it's a slow, subtle erosion of presence. Self-touch isn't only about desire or gratification, it's about acknowledging that you're still here, that your body still matters, that you're not just inhabiting a shell, but living within a living, feeling part of yourself. When you abandon that, even unintentionally, a kind of distance forms. You stop noticing how your shoulders feel. You ignore the aches in your hips. You stop glancing at yourself in the mirror. And worse, you start believing that this phase of life no longer deserves care, attention, or intimacy. And that's when something deeper starts to fade, your sense of worth. I've watched this disconnection lead to emotional numbness, shame about aging, a retreat from even the simplest forms of affection. People stop moving with confidence. They stop dressing with pride. They stop nourishing their bodies with intention. The thought creeps in, why take care of a body that no longer feels like mine? One woman confided in me that she hadn't touched herself since menopause. She said, I just stopped feeling like a woman, and the less I touched myself, the more I disappeared. That word disappeared struck me, because that's exactly what happens for so many older adults. They don't just lose physical sensation, they lose identity, visibility, and a sense of being fully alive. But it doesn't have to be that way. Reclaiming your body isn't about returning to who you were at 20. It's about embracing the life that's still in you. It's about standing in front of a mirror and quietly saying, I still matter. I still deserve to be seen, even if it's only by me, even if it's only in the privacy of my own home. That act alone of reconnecting with your body has the power to undo years of emotional erasure, to remind you that aging is not vanishing, that your worth never expired, that your story didn't stop because you turned 60 or 70 or 80. You come home to yourself, and that may be the most healing act of all. As we come to the end of this journey, let's step back and look at the bigger picture. Because while each of the 7 consequences we've explored carries weight on its own, together they reveal something far more urgent. They form a pattern, a warning, a message Over the years working closely with aging patients, what's impacted me most hasn't just been the medical issues, the lab results, the symptoms. It's been the invisible grief, the quiet sorrow that doesn't show up on scans. The man who once carried himself with confidence, now looking away from his reflection. The woman who once danced with ease, now saying she hasn't felt anything real in years. And what's worse, they've been told this is normal, that this is just aging, that it's time to let go. But I don't believe that, not for 1 second. And if you've made it this far with me, neither do you. Here's the truth. The moment you stop caring for your sexual self, the moment you stop seeing that part of your identity as alive and worthy, you trigger a quiet chain reaction. Prostate and urinary health start to decline. Cognitive sharpness dulls. Emotional resilience fades. Sleep becomes restless. Circulation weakens. The immune system falters. And all of it stems from one neglected truth. Your body is still calling out for connection. This isn't about performance or proving anything. This is about reclaiming ownership over the one home you never move out of your body. Reclaiming your spark, your strength, your voice. So let this be your turning point, your invitation to come back to yourself. Not with shame, not with guilt, but with permission. Permission to feel again, to care again, to live again, because you are still here. And that matters. And perhaps one of the most painful losses of all is what happens when we give up that quiet, private connection with our own body. When self-intimacy fades, so often does self-worth. It doesn't happen overnight. It chips away quietly. Until one day, you no longer feel at home in yourself. You feel like a stranger in the very body you've lived in for decades. And that, my friend, is not just a side effect of aging. That is your body calling out your mind, signaling a need, your spirit asking not to be left behind. These are not small things. They're not trivial changes to shrug off as just getting older. They are warning signs, invitations, clues that a part of you, very much alive, is waiting to be acknowledged again. I've sat across from countless patients in my decades of practice, men and women in their 60s, 70s, even 80s. Many came in feeling disconnected, numb, or broken. But I've seen the spark come back, the shift in posture, the clarity in their voice, the light in their eyes. And all of that began with a single decision to stop, waiting for permission, and start giving it to themselves. It doesn't take a partner. It doesn't demand youth or perfect health. All it takes is one choice. The choice to believe you are still worthy of connection, that you are still allowed to care for yourself in the deepest, most human way possible. And let me say this as clearly as I can. This isn't indulgence. This isn't vanity. It's health. It's science. It's healing. Masturbation in later life is about circulation. It's about calming your nervous system. It's about balancing your hormones, boosting your immune response, lifting your mood, and yes, grounding your sense of identity. This is not optional. It's vital. It's how we remind our own body. We're still here. We're still alive. We're still responsible for this one vessel we've been given. One patient, after years of avoiding this topic, told me something simple yet profound. I didn't realize how much I missed feeling like myself until I finally touched that part of me again. That's what this is about. Not just surviving your later years, but truly inhabiting them. With presence, with dignity, with joy. So if this part of you has been hidden away, neglected, judged, or forgotten, I invite you to come back. Not out of obligation, but out of compassion, out of the truth that your body is still listening, still waiting for you to come home to it. Start small, start with curiosity, start with kindness. But start, because when you reconnect with this part of yourself, you're doing more than improving your health. You're reclaiming something that belongs to you, your vitality, your sense of self, your right to feel fully alive. And if anything in this message spoke to you, don't keep it in silence. Let someone else feel seen. Share this video, leave a comment. Whether you agree or disagree, your voice matters. Your story might be the lifeline someone else didn't know they needed. This is Healthy Hues Wellness. And your life, your intimacy, your health, they're not over. They're still yours to protect, to honor, to feel,